Alrighty, I'm going to go over Mrs. Davis's medical history. She's an 81-year-old female who's been visiting us after having a fall due to her having a stroke. She is going to be here, and she has osteoporosis, multiple vertebral fractures, both in her medical history, along with hypertension, depression, and constipation due to her pain medications that she's receiving. So she is going to receive Plavix 75 milligrams, Microzide, Remeron, do Benadryl 25 milligrams, Ativan every 12 hours as needed, Prilosec daily, and Percocet as needed for pain.
Okay, how are we doing over here?
Good, just doing my first checks for Miss Davis's medication.
Great. So what exactly are we going to be giving Miss Davis today?
Well, her medications include Plavix 75 milligrams.
Okay, and what is she receiving Plavix for?
After she had her stroke, it's going to help prevent blood clots for her.
Okay.
Alrighty, and then she also has Microzide, and that.
And Microzide is a diuretic?
Correct.
Okay.
She's going to be given that for her high blood pressure.
Okay. Any parameters that we need to be checking before giving her this medication?
Her blood pressure,
Okay.
and that was within normal limits when I had just taken it.
All right. And
So-
is there a reason why we are giving her this during the day?
Because we don't want to give it within 4 hours of her going to sleep, otherwise she will be staying up all night voiding.
Okay, good.
So, and then the next one is Remeron, and that she is actually given at bedtime.
And is there anything in her history that is related to her receiving it at bedtime?
It is given for insomnia and depression
Okay.
that she has, so it'll help her sleep.
Great.
And that's 15 milligrams.
Okay.
Okay, and she also is going to get Benadryl 25 milligrams as needed
Okay.
at bedtime.
Great. Any patient education that we should be teaching Miss Davis with Benadryl?
With Benadryl, we should let her know that it will make her drowsy,
Okay.
and that's why we're giving it to her at bedtime.
Very good.
Okay, she will also receive Ativan every 12 hours as needed.
All right.
Okay, and that's given she's supposed to be given half a milligram, and these are in 1 milligram score tablets, so we'll have to split one of those in half for her.
All right. Any patient education with Ativan? She is receiving this PRN, but anything we should tell her?
Make sure she's not consuming any alcohol while on this.
Good.
Okay, and the next medication is Prilosec. And she's receiving 40 milligrams of that daily.
All right. So with Prilosec, there is an increased risk of bone fractures. Is there anything in her history that we need to be aware of?
She does have osteoporosis and has had multiple vertebral fractures in her history.
So with that, we're probably going to hold that and notify the RN
Okay.
just to make sure that they're aware of that.
Okay.
Okay.
So I'll set that to the side.
Good.
And then she also receives Percocet every 6 hours as needed.
And this is for the pain. Okay. So any patient teaching on Percocet?
It does cause constipation, so we will want to inform her of that.
Okay. So anything on her MAR to help her with constipation?
She does not have anything prescribed for her now.
And you did say that she had a history of constipation.
Yes.
So we're going to go ahead and notify the doctor for that as well. See if we can get something for her constipation.
Alrighty.
Great. So allergies for the patient?
She has no known allergies.
Okay.
No.
And go ahead and tell me your 6 rights for administering the medications.
Alrighty. I want to make sure she's the right patient, so using 2 identifiers. And I'll ask her name and her date of birth.
Good.
The second is making sure I have the correct med, which I did once before you got here.
Okay.
Second time was with you, and we'll do a third time right at the bedside.
Okay.
Okay, and let's see, right patient, right medication, make sure it's the right dose that we're going to be giving her, the right route, which all of hers right now are PO by
Okay.
mouth, and it's the right time, and when we're all finished, the correct documentation.
Great. Good job. Let's go ahead in Miss Davis's room.
Alrighty.